All right, guys, we're back on Therapy is Dope with Alicia and Laura. And of course, Laura is not here with us today, but that's okay. We have a special guest, David Crow, and I'm really excited to get into his background and find out what we can learn from him. So, David, if you don't mind, could you tell us a little bit about your journey taking you to where you're at now?
I don't mind. Thank you for the invitation. So I started studying classical Asian medicine 40 years ago. I was one of the first Westerners to go to acupuncture college. In the first acupuncture college that opened in the 80s in San Francisco. So I was in the first generation of people to become licensed as an acupuncturist and open a clinic practicing Chinese medicine. But at that time, the educational level was not very high. And I was particularly interested in the cultural and spiritual roots of Asian medicine. So I ended up going to, excuse me, going to the Himalayas, moving to Nepal and living in Kathmandu to study with an several Ayurvedic doctors, and a primary teacher of Tibetan medicine. So I was one of the first Westerners to actually go to Asia and apprentice internship, classical style, with Ayurvedic and Tibetan doctors. So that's how things got started, but a step at a time that went into a lot of other dimensions of work, and I became very aware of the ecological, uh, environmental conditions that were happening to plant medicines, the loss of biodiversity and how that affects plant medicines. And so I got involved in preservation, ecological, environmental preservation projects around the world to protect and rejuvenate, restore medicinal plant cultivation. And throughout this entire time, I've had a clinical practice for 40 years. And I have also been very interested in how the classical Asian medical system is closely related to the spiritual practices as well. The medical and the spiritual lineages were always very closely related. And so that is a major interest of mine. And this is all still going on now, 40 years later in my clinical practice. I'm working with people primarily in telemedicine now as a herbal consultant mostly, but I also teach meditation practices and produce courses and do a lot of medical research and so on. So that's a very brief introduction to a very long story.
I love it. I have so many questions already. I have a book called Be Your Own Shaman, and it's all about plant medicine and what different plants do to help you. Uh, so I'm very interested in that. But I'm sure that's not exactly just the point of what we're going to be talking about today. So I want to go back a little bit. I've heard the word when you were talking about the Tibetan medicine and Ayurvedic. Is that how you said it?
Ayurvedic.
Ayurveda. Okay. What is the background of that word? Where is that from Nepal? Is that I don't
Yeah, good question. Well, Chinese medicine is rooted in Taoism. Okay. And Ayurveda is the medicine of India that is rooted
Okay.
in the Vedas. Okay. And so right there, we see the cultural relationship between the medical system and the spiritual history. So Chinese medicine uses herbal medicine, Ayurvedic medicine uses herbal medicine, and both systems are based on very similar cosmology. Okay, and so we hear terms like prana, life force, in Ayurveda, and we hear terms like qi, life force, in Chinese medicine. So Chinese medicine and Ayurvedic medicine are two different medical systems from two different parts of Asia, but they share a lot in common, and they have very similar spiritual roots, and they share a lot of herbs, and they share a lot of similar treatments, but they also have differences. Okay, so Ayurveda is more known now as the medicine from India, and Chinese medicine, the medicine from China. But these systems are also closely related to all the classical medical systems in that region. It's closely related to ancient Greek medicine, for example, and Persian medicine and Tibetan medicine. So every culture had a slightly different interpretation of these underlying cosmologies and spiritual practices and concepts, but they all shared a lot of the same herbs and a lot of the same treatments, and they also had their own unique herbs and treatments as well. So that's Ayurveda, and the term itself, Ayur, means life, and Veda means the science or the wisdom. And so Ayurveda, translated very simply, means the science of life or the wisdom or the teachings of life.
Oh, that's beautiful. Okay, so now I'm curious, what are some of the things that overlap and what are some of the things that are different?
Good.
And bring in the spiritual because I don't think that we should separate that anyway. To me, looking at things from a holistic perspective, you really can't separate it. So I'm curious what your thoughts are.
Good. Well, that's a huge topic. So all of these systems shared plants as the primary medicine, and that's how it's always been. Plants are the oldest form of medicine that humans have used. As a matter of fact, there's evidence that plant medicine was being used by Neanderthals in their caves. And so plant medicine goes back a very long time, and plants grow in different regions, and some plants grow in all the regions. So one of the things that is shared among all of these medical systems all over Asia, as well as all over Europe, and even all over the Americas, is that there are some species that are universal. There are many herbs that actually grow everywhere in the world, and so different cultures have used them. Now, in some cases, cultures have used them for almost exactly the same thing.
Interesting.
But in some other cases, cultures have focused on very specific uses that are different. For example, hawthorn is famous in Western herbology as a medicine for the cardiovascular system, for strengthening the heart and for helping to lower cholesterol and so forth. And the hawthorn in Chinese medicine is also used, but they use it to help digest food stagnation. Now, it's interesting because those things correlate, all right? Because if you have a tendency towards food stagnation, then you're probably eating too much fatty food. That means your cholesterol is probably too high and putting stress on your heart. So it's the same basic herb, but it's used in different ways. Now, that's one example of similarities and differences. Then we also find a universal similarity with all medical systems, and that is a close relationship with spiritual practices. And therefore, what we can see is that in Tibetan medicine and Ayurvedic medicine, there was a lot of emphasis on relating to the plant as a living being, and so rituals and ceremonies were done when harvesting the plants, and prayers and mantras were used when preparing the medicines and when administering the medicines. And so we see that there's a very old integration with spiritual practices and handling and using the plants and using them as medicines. Now, that's universal, but we find that its expression and form is different in every culture. And so if we imagine that we are in Tibet 200 years ago, 300 years ago, then what we would see is in the monasteries, there would be major ceremonies, sometimes lasting for, 7 days, where there is a big container of herbal mixture that is being consecrated by hundreds of monks. And there's a big ceremony that's going to transform this physical substance into a spiritual substance. Okay, now that's using sound and visualization and prayer, and that's a unique example. Um, but we also find the same thing if we go to the Amazon, and the shamans there are going to be singing songs and reciting prayers as they are making their medicines and giving the medicines and leading the ceremonies for healing. So that's universal. That's everywhere. Humans have always used some fairly common practices, prayer, mantra, voice, the human voice, and intention, visualization, and so forth in rituals and ceremonies to bless the medicines and potentize them spiritually. But the differences in how this is done are based on the different cultures. And so, for example, in Tibetan medicine, it is a Buddhist culture, and therefore the deities that are being invoked to come into the medicine are Buddhist deities, whereas in Ayurveda, it is primarily a Hindu culture, and so the Hindu gods and goddesses are being asked to come and bless the patient or the medicines. And in Chinese medicine, it's based in Taoism. And so the Taoist immortals are being asked to come and participate. And so it's the same process within our consciousness and relating to the plants, but it's culturally defined. So those are a few things about some similarities and some differences. Treatments, we see the same thing also. We see that there are universal natural medicine treatments everywhere, which include purification practices, sweat lodge, things like that. Massage is universal. Acupuncture was really more developed in China than anywhere else, but the knowledge of the pressure points and acupuncture points was known pretty much around the world as well and incorporated into different systems. So we find that a lot of the therapies are universal, but each culture developed the therapies in different ways as well. So we find in northern China, for example, that there's much more emphasis on using herbs cooked in meat soups that are really warming and nourishing and strengthening for a cold climate. Whereas we find in South India, which is a really hot climate, that it's primarily vegetarian. And the practices have a lot more to do with detoxification and cleansing and lightening the body and cooling it down. So a lot of the medicinal practices are actually based on the climate and the geography as well. So those are a few things to answer that great question.
So I used to have a wellness spa and we had acupuncture there. So I learned a little bit about it. And the hot and cold, I know, is a big element to treatment. There are certain, but the thing that really got me is that there's certain areas associated with different illnesses. So I'm curious if that translated across cultures as well. Like, um, you know, I remember telling the acupuncturist once that I was having some anxiety, but that I also kept getting um, kidney infections. And so she said, "Oh, well, I think your anxiety is trapped in your kidneys," and went and got this tool that like put pressure on the kidneys. So I'm curious if you what you think about where different problems are held in the body.
Okay, so what you are referring to then is a specific system in Chinese medicine, uh, which is a way to explain the body-mind relationship. All right, and so in Chinese medicine, the organs are associated with primary emotions. That's what you're talking about. Okay, so the lungs are associated with grief. The liver is associated with anger. The kidneys are associated with fear. The spleen is associated with worry. Okay, and so on. Now, on the one hand, this is a very important model to understand the body-mind relationship, but it doesn't always work diagnostically in any meaningful kind of way. All right.
Okay.
And therefore, we have to be careful when we use these classical medical systems to make sure that they're relevant and that they're accurate. And so let's take the example of the liver and anger. Okay, now, uh, if a person has a liver pathology and say they have hepatitis, okay, um, does that automatically mean that they're going to be angry? Or does that automatically mean that their hepatitis was caused by anger? Okay, that's where we have to be careful about cause and effect. Now, if a person has hepatitis, they're going to have emotional disturbances because they have hepatitis. They're not going to feel good. And a part of it is that they will be exhausted and they will have sadness and they will have frustration and they will have irritability and they'll have anger because they have to deal with having hepatitis. So we can't really say that the liver is causing the anger. What we can say is that everybody has emotional disturbance when they get sick. Okay. And therefore, we can't correlate clearly that liver causes anger. And we cannot correlate clearly that anger causes liver problems. That's where the emotional diagnosis kind of breaks down a bit. So what we see then is that people try to correlate things backwards,
Mm.
basically. And so in the case of anger uh, harming the liver, we can see how that works, however, because people who have, anger management problems also have a tendency to have other problems that are bad for the liver, like alcohol. Okay.
Mm.
And so then if we look at it holistically, we can say, yeah, there's definitely a correlation, but it's a lot more complicated than just saying, well, this causes this. And so in your particular case, could we say that uh, kidney problems were causing anxiety medically? Sure, of course. All medical problems cause anxiety. But uh, was that coming from the kidneys or just coming from the fact that you weren't feeling good and had to deal with this health problem? And then on the other hand, we could do it the other way and say, was anxiety causing the kidney problems? And that's where a lot of this diagnosis doesn't actually work at all.
Mhm.
People have a tendency to think that their mental and emotional states are directly responsible for their illness. And in many cases, they're not at all. Okay. And that's a big subject.
Yeah.
People tend to be very hard on themselves about why they have illness and tend to blame themselves for all kinds of things that aren't coming from their emotions at all. They're coming from, the toxicity in the environment. They're coming from lifestyle issues. They're coming from very understandable causes. And people have a tendency to keep looking in, the past for, traumatic memories. And they keep trying to make it like I have to fix something inside myself, when in actuality, everybody's health is suffering now from all kinds of complex collective reasons. Okay. So that's another thing to keep in mind about that particular model. But sometimes it's really clear and it's very helpful, but it's not such a good starting point. It's more like, well, all right, you kind of diagnose it retroactively, and then you can see, okay? And this the same is true with that system where not only are the organs associated with different emotions, but the organs are associated with different sense organs as well. So, for example, people often ask me, um, I'm having problems with my eyes. Does that mean that I have a liver problem? Now, sometimes liver problems can affect the vision, but it doesn't work the other way around. The vision problems necessarily affect the liver, and sometimes people just have a problem with the eyes. That's all.
Hmm.
So we have to be open-minded and careful with the classical diagnostic methods and make sure that they're relevant and updated for what we know now.
Okay. I appreciate that for sure. Do you see patterns in your work as far as the mind-body connection, aside from maybe like alcohol and liver?
Oh, sure. I mean, probably one of the most common things that's coming out now is gut-brain axis.
Mm.
Okay. And so there's a really clear link between what we eat and how we feel. What a what a concept. It's
What?
like who would have known that if you eat certain things that you're going to feel better, and if you eat other things, you're going to feel worse. So that's a really big topic in, my telemedicine consultations is making a link between the diet and how people feel mentally and emotionally and energetically and how they sleep and the link between the diet and gut function and inflammation in the body, and the link between the diet and gut function and musculoskeletal pain and immunity. I mean, this is basically what natural practitioners should do, is that they should really help people understand the links between the body and mind. They should help them understand the links between lifestyle and how we feel. Cause and effect. We're really trying to track down cause and effect. And we're also trying to track down the chronology of the cause and effect. And so another big area that I work with is people who either uh, are on medications and want to get off, or people who are being urged to go on medications who don't want to do it. And what are the alternatives? And one of the main exercises that I always do with people uh, in the initial consultation, if they tell me they have been on that they're on medications, then I ask them, well, did you study the medications? Now, when a doctor prescribes a medication, they should educate the patient about the potential side effects, but they generally don't. And if a patient starts to take a prescription medication, they should educate themselves, even if the doctor didn't. But patients don't do it either. And so it turns out to be my responsibility in a lot of cases to simply point out, well, okay, you started a statin 6 months ago, and did the doctor tell you about potential side effects? No. Did you research it? No. And so we do a little exercise and we go to drugs.com and we plug in, the statin that they're on, and we look at the side effects, and there it is, primary side effect, pain and inflammation of the muscles and joints. Did you make a connection between starting that medication and the fact that now you've got pain in the muscles and joints? No. Okay. So that's a real basic exercise. Those are patterns, okay? That's a sociological pattern because people are involved with medications. And the pattern is that people are not educated about the drugs or the potential side effects, and they don't make the link. And since they don't make the link, they go to back to the doctor, and he says, "Well, okay, here, let's just start you on some non-steroidal anti-inflammatory drugs for your pain and inflammation." And then the next thing, 6 months later, then they're having all these digestive problems, and they go to the doctor again. He says, "Well, okay, now let's give you some, you know, um, proton pump inhibitors and put you on Prilosec." And within a year, you've gone from starting a statin, which maybe you didn't even need, to being on anti-inflammatories, which were for treating the side effects of the statins, and now you're taking medications to treat the anti-steroidal medications. So that's a pretty common pattern. All right. So that's also what's there. And that's also related to the first topic of let's get really aware of what the body's doing and let's be aware of cause and effect. So that's a quick overview of a big subject.
Yeah. So, question on that front, when it comes to diet, do you have specific things that you recommend to people, or are you more of like an elimination diet? Let's see what exactly works for your body kind of thing.
Well, that's a great question. First of all, the situation that I am addressing the most with people is confusion. Okay,
Hmm.
they're confused about what to eat and what's best. And that's because there's so much conflicting information out there. And that's all mixed up with marketing also. And all these products that you need this and you need that, and everybody should take digestive enzymes, and everybody needs a detox, and everybody should do this flush, and everybody, and the thing that's incorrect is the concept that everybody should do this. Okay, now there are basic principles of the diet that we start with, and then we work from there according to a lot of different factors. Okay, but every individual is unique, and that's what makes it complicated, is that all of these products that are out there all have to go through your stomach. And one of the things that I deal with constantly is when I get the health history, I say, well, are you taking some herbs or supplements? And they say, yeah. And I say, well, how many things do you take every day? They say, well, I take like 100 things. I take 100 products, and I take them in big handfuls on an empty stomach. And I point out, well, that's probably why their stomach hurts. Okay. And so we sort it all out. And one of the basic principles of uh, discovering what works best is simplify things. And so we start with a kind of elimination. It's not elimination as much as it is simplification.
Mm.
We just ask a basic question. What does the digestive system want? How does it function the best? Okay. And we find that what helps the digestive system the most is for a lot of people to eat less, stop snacking, eat regularly, and stop taking so many herbs and supplements. And their digestive system feels better. Okay. Because the digestive system has to do all this extra work when we take all these extra things. And so we want to simplify it and give the body less work. More is not better when it comes to supplements. More is not better when it comes to detox. Okay. The body knows what to do. We just need to leave it alone a lot of times. So the starting point then is a simple diet that gives very little work for the digestive system. And it's amazing how much benefit that can produce. It can even cure chronic digestive problems. And so it's kind of like a baby food diet. It's like everything is soft and warm and easy to digest. And instead of raw kale salad, which is hard to digest, you have vegetable soups. Okay. So this is a principle that is shared in both Chinese and Ayurvedic medicine is support the digestive system by not stressing it. Don't give it too much work to do. Make everything really easy to digest and very nourishing and kind of pre-digested as well. And so cooked food is easier to digest than raw food for most people, especially as we get older. And this is another aspect of the diet is that uh, diets can be very different when we're 20 years old than when we're 70 years old because our digestive function declines as we get older. And so we have to modify that. And our nutritional needs change as we get older. And so it's relatively safe for most people to be vegetarian when we are younger. But then when we get older and we get past our 60s and 70s, and people start losing muscle mass, and they actually start to need animal protein, collagen, blood, okay, for anemia. They start to need these things more. And this is a normal physiological process. It's not ideology, it's physiology. Okay, so we have to take the basic principles and adjust them to a variety of different factors, with age being primary. In other words, we have stronger digestion when we're younger than when we're older. And we are much hotter in our constitution when we are younger than when we're older. And we're much stronger overall when we're younger and much weaker overall when we're older. And we have to adjust everything accordingly. So it's also based on climate. You know, people in South India can have a vegetarian diet more easily than people in the Arctic. Okay. So uh, we modify it then according to the individual, which has always been done. It's always clearly stated that, you can't feed babies, heavy food. It has to
Hmm.
be, it's got to be ready for their digestive system, which is not developed yet. All right. Well, the same for old people. So we see these kind of principles, but then in the clinical practice, what we always have to work with is the condition of the stomach. And this is a basic reality about natural medicine that is also a reality for pharmaceuticals, which is that we can have an herb or a drug which is good for some part of the body, but not good for another. All right. And therefore, people can get benefits from taking over-the-counter non-steroidal anti-inflammatory drugs, and it's going to be helpful for the symptoms of pain and inflammation in the muscles, but it's going to be terrible on their stomach and their liver. And we can see this with everything. Every single supplement, every single herb has that potential. And so people frequently take supplements because they heard, well, this is really good for something at the cellular level. Okay. This is going to help me detox at a cellular level. That's what I've heard. That's what the science says. But then they take it and it hurts their stomach. It's inflammatory to the stomach. And therefore, we have to put everything in the proper context, that it doesn't matter what the product says. It doesn't matter what the product is. All that matters is, what does your stomach say?
Yeah.
Okay.
How is your
And
body responding?
exactly. And that's where we've got to slow down and back up and simplify and see what actually works. So when I'm working with people and they're taking a lot of different things, then I say, well, let's just simplify, clear everything out, because it's not targeted. Okay, that's another aspect of a lot of self-diagnosis and self-treatment, is people have these huge home pharmacies and they don't know what they're doing. They're just using this shotgun effect of taking all these things because they heard they're good. And that's frequently a naturopathic and a functional medicine approach also. My approach is much more based on my classical training, and that is, you have a clear diagnosis and you have a clear treatment strategy. You have clear objectives. And so frequently, the first objective is, let's get the stomach comfortable, and then we can work on the muscles and joints, okay? Or we can work on the liver, we can work on anything else, but it doesn't matter because right now you've got GERD. And
Yeah.
right now you've got reflux. And therefore it doesn't, you know, all of those things that the naturopath gave you, they're not relevant. They're probably worsening the GERD. So we have to treat the first things first. And as soon as we put something in our mouth, the first thing is the stomach. And so we've got to protect the digestive system. So that's, a quick overview of some pretty important principles of healing.
Yeah. So with that in mind, I have one more question on that. Is there such thing as too much probiotics?
Most of the probiotic supplements, they work differently for different people. Now, why would you want to take a lot of probiotics anyway, is the question. How effective are they going to be? What is too much? Okay, so if you have a probiotic product, Okay, that's one thing. Now, let's say you have a probiotic product and it says take 2 caps, with your breakfast. Okay, now why would someone want to, take more than that? Well, a good reason would be that they were on antibiotics. Okay. And they feel like, okay, I should increase that. Now, probiotics are relatively safe overall. Probiotic supplements are relatively safe. The problem tends to be more that they're not really that effective in terms of treating colon problems because in order to recolonize the microbiome of the large intestine, you got to do a lot more than just take probiotics. Okay, because the probiotics are also going to be destroyed primarily in your stomach. There's not going to be a whole lot of probiotics that actually get to the large intestine. Okay, that's a weakness of probiotic supplementation. But that doesn't mean that we can't restore healthy microbial ecology in the large intestine. It's just that we have to do it more holistically. All right, now, another way is not that you are taking probiotics and expecting it to just go all the way to your gut and magically everything's fixed. Okay. You can also think in terms of fermented foods. Now, you can definitely take too much fermented food because it's acidic and
Mhm.
sour. And people, this is an example of you hear that something is good for you theoretically, but in practice it isn't. So people hear fermented foods are great, but then it upsets their stomach. Now, that's because of the acidity. Now, there's ways around that and learning how to do home fermentation of things that are mild, like sauerkraut. Mild sauerkraut is a lot easier for people to digest than, say, really fiery hot kimchi, okay,
Yeah.
with lots of peppers in it. So we can modify all of these things. And the concept then is that we think in terms of long-term gradual rebuilding of the gut microbiome, which is incredibly important because the gut microbiome is what prevents toxins from the food chain to it prevents them from penetrating through the large intestine mucous membrane into the liver. Okay, so in other words, our gut microbiome is always detoxifying, and it is the barrier that prevents the toxins from going deeper in the body.
Mm.
But probiotic supplementation is only part of it, whether it's products or whether it's fermented food, because we've also got to think in terms of how to regulate the peristalsis, and some people have too much peristalsis, they have loose stools, or they have constipation. And we have to be very careful in treating constipation because that can weaken the colon further. So we think in terms of, well, why is the gut microbiome off in the first place? How do we know that it's off? Okay. This is a source of great confusion for people. So obviously we have factors that deplete the gut microbiome like antibiotics, stress and alcohol and smoking, unhealthy lifestyle. All these things are bad for the gut. So we have to work on it very holistically. And usually there's a combination of things that we use, not just one probiotic. Okay, it's very important when we are targeting systems like this. We also think about gut immunity. So what are the herbs for gut immunity? We think about gut inflammation. What are the things, herbs and foods for inflammation? We have to think very holistically about it.
Okay. All right, so let's then shift gears a little bit to the meditation part of what you do. From my perspective, and I've said this on here before, meditation can be confusing too, because there's so many different kinds, and like for example, if you just go on YouTube and type in meditation, there's going to be thousands of videos that come up, and how do you know which one to do, and how do you know which one will work best for you, and is there a right way to do it? So I have a lot of questions around that for you.
Good. Okay, well, let's start my answer with asking you a question. What is the purpose of meditation?
I used to believe the purpose of meditation was to clear your mind. I don't necessarily think that anymore. Um, Recently, I had a guest on the podcast who was talking about the importance of focusing on opening your heart, and I could understand how that would be useful. I don't know if that's what everybody should be aiming for. I don't know. I'm open to suggestions here.
Okay, well, let me ask another question.
Okay.
Well, and these are closely related, okay, topics, clearing the mind and opening the heart. What does opening the heart mean?
I would assume it's focusing on loving yourself, loving others, accepting love.
Okay, so it's not something that a cardiologist is going to give an answer to then, right?
Right.
Opening the heart means surgery, right?
Yeah.
All right. So that's a good place to start. Okay, clearing the mind and opening the heart.
Okay.
Now, in general, uh, the more clear the mind is, the more open the heart is, and vice versa. Now, I'm saying that without any real definition of what either of those terms mean.
Mm.
Okay, but to go back and answer the question, what is the purpose of meditation that I asked you, we have very different interpretations through history
Mm.
and in different cultures and different methods and different objectives. Okay. And so now, uh, in general, the objective of meditation is actually relaxation,
Mm.
stress reduction. I would say that the majority of things you're going to find on YouTube have to do with stress reduction. Okay. Now, stress reduction was not the primary objective in the traditional cultures. Okay. The primary objective was completely different, and that was complete transcendence of
Mm.
existence, complete liberation from bondage to the body. Okay. So that's a pretty deep subject, but we can look at a couple of terms that describe it. And if you look at the Ayurvedic uh, definition and the Vedic definition and the Tantric definition, which is very closely related also to the Buddhistic definition, there are two words that are really important to know. One word is moksha. Okay, now moksha is clearly articulated as the goal of spiritual practice. That's why people did spiritual practice of all types, including different types of meditation. They had a goal. They were going for a goal. And they were not going for stress reduction. They were going for moksha. Okay. Moksha means emancipation.
Mm.
And it means specifically emancipation from bondage to the senses. Okay, so the ultimate goal of meditation, as defined by moksha, means that we become completely mentally, emotionally, and spiritually liberated from this existence. It doesn't mean that we die. It means that we are completely at peace. It means that we are completely liberated from entanglement with the world, freedom, transcendence, inner peace. Okay. Now, another closely related word of the ultimate goal is nirvana. Okay. Now, nirvana is mistranslated frequently as meaning some kind of blissful ecstatic state. And
I was thinking.
that's and that can be experienced in deep meditation, of course, but nirvana had a completely different meaning in the classical use. Nirvana as an ultimate goal is paired with another term, samsara. Okay. Now, samsara means the cyclical nature, it means a whirlpool. It means a whirlpool of suffering. And that's what people recognized, you see, because people in the past were surrounded with the reality of life and death. Okay. People died young from illness, and uh, then they were right there. People had to carry them out, bury them in the cemetery, put them in the fire. Life and death was very immediate, and people knew that impermanence was everywhere. Now we've become a little bit insulated from that in modern times. We've done our best to insulate ourselves, but it's pretty inescapable if you live someplace like Ukraine, you know. And therefore, there was always this question, what is the purpose of life? And it was recognized widely that the highest purpose of life was a cognitive accomplishment. Okay. It was the accomplishment of transcendent consciousness, not just, we're going to make money and have kids and then that's the end. Okay. It was really to fulfill our spiritual potential as human beings, which means fulfill our highest cognitive function, which is self-awareness and self-knowledge. So samsara was defined as that which we are all in, which is this big ocean of suffering, life and death and rebirth and all of these different forms of suffering. And so meditation had an ultimate purpose, which was to get out of that, which was moksha as one definition, emancipation from that, and nirvana. Now, nirvana was originally translated, and its original meaning was cessation, ceasing. Okay, now that doesn't mean that people were uh, going for an ultimate goal of non-existence. What they were going for was an ultimate goal where the patterns in consciousness that keep us bound to this life stop. And what emerges is our pure consciousness, which is called different things. What happens when we achieve moksha? Well, in the Vedic lineage, it says we have achieved self-realization. Okay, we have achieved awareness of God. We have achieved awareness of how we are part of God consciousness. Okay, and in the Buddhistic sense, it is described as being we have discovered our true enlightened mind. Okay, so these are big questions about what they actually mean and how to do it and what a person experiences it when they achieve it. These are huge questions that people have asked and debated and studied for thousands of years. But the point is, all of this is much different, much deeper, much more profound than stress reduction. Okay. It naturally leads to stress reduction because if we actually accomplish moksha, liberation from bondage, then we are free of all stress, all everything. We're free of everything. And we don't need stress reduction because we're emancipated. Okay. So that's the bigger context, is to ask the question, what is the purpose of meditation? And the purpose now is defined very much in this kind of therapeutic sense, which is excellent. People need it. But there's an inherent problem that happens right away. And that is that our culture is so collectively stressed mentally,
Mm.
people cannot meditate. And so people have no sense of what meditation actually is. Meditative states are clearly articulated in these classical lineages as this is this particular level, and then there is this level, and then there is this level, and then you're getting deeper and deeper and deeper and deeper, and then you're entering this level where you lose awareness of your body, and then you enter into this level where everything turns into light. And it's clearly articulated that there is a path that
Mm.
we can progress on through training, okay? And we can enter into these very profound states of relaxation and tranquility And these are all given names in these systems. It's a science, actually, of learning how to liberate ourselves through the study of consciousness. And that's what meditation is, the study of our own consciousness and the training of our own mind. Now, this is very different than let's meditate to relax, because many people cannot meditate because they're too tense. And so therefore, the confusion is, well, what am I supposed to experience here? What is the purpose of meditation for me? It makes it a lot easier to understand if we start from the other direction and we say, well, let's learn how to relax first.
Hmm.
And let's learn how to retrain the brain to get out of this constant state of tension. And that's very therapeutic. And so, therefore, instead of trying to meditate, we learn how to activate the relaxation response at a very, very deep level. And that takes training and it takes a long time. But we learn how to gradually use breath and yoga and stress reduction techniques and visualization and diet and all of these different things. And we can step by step enter into activating, turning on the parasympathetic relaxation response and turning off the sympathetic stress response. And there are many practices that can help people do this relatively quickly, but it takes training. We have to train the mind how to get out of, they have to train the brain, actually. It's a physical thing. We have to train the brain how to shut off the stress response. Now, as we learn how to enter into deeper states of relaxation, then we start to notice really nice things happening. So, one of my favorite practices uh, comes from Taoism, and it's called Xing Qi breathing. It's very, very simple mindfulness of the natural breath, but you have to do it for a long period of time. But within a relatively short period of time, a phenomena starts to happen, which is that the body starts to feel lighter and lighter. And then it starts to feel very insubstantial. And the Taoists describe it as bones dissolve into clouds. All
Hmm.
right. Now, that raises really interesting questions. What is the body? How is it that we can sit down and the body feels so tight and so heavy and so tense, and then we do a simple breathing exercise and the substantiality of the body begins to dissolve into space, lightness, a luminous body of rainbows, as they say. Okay. How is it that the subjective experience of the body can change so profoundly through meditative or relaxation practices? And the answer is the body doesn't ultimately exist separately or outside of the mind. In other words, what the body is to our subjective awareness is nothing more than a stream of sensations. And it's only happening part-time because then we fall asleep. Okay. And we're not experiencing the body anymore. And then we wake up, we're experiencing the body. So, in other words, the body comes and goes within consciousness. And that gives us the key to how we can begin to enter into deep meditation. We train ourselves to enter sequentially into deep relaxation. And in that, we learn that we can dissolve the body into lightness. And it can become very clear, translucent. We begin to feel the body as having no blockages, totally comfortable. And we realize that the body is not just food and water and matter. The body is also prana and chi and energy. And we can also realize that body is also space. And so when we experience these deeper states of relaxation, then we're starting to enter into meditation. And meditative states then grow and develop sequentially from that into deeper and deeper insight into the nature of the mind and into the nature of the mind and body relationship. Okay. And ultimately we reach self-realization. We understand completely what the nature of our consciousness is. We understand the nature of how consciousness entered into matter. We understand how consciousness comes and goes with matter, and we understand how consciousness will leave matter. Okay. And that level of self-knowledge is enlightenment. It's very profound because it represents a very clear state of mind, mental clarity, because we're perceiving reality. And that naturally makes us very open-hearted because immediately we can start to see that all the suffering around us is, a source of compassion because we're all in this ocean of ignorance about the true nature of who we are. Okay, so that's the bigger context of the purpose of meditation.
So, where would you say we start? We're at the end of our time now, and I have a very strong interest in consciousness and have gone down a lot of rabbit holes. So, where would you suggest that people start?
Well, this is what I incorporate into the medical consultations as well, because
Mm.
uh, stress makes it very difficult to get well,
Yeah.
and relaxation makes it a lot easier. And so people ask that question, how should I meditate? What technique should I do? I have so much difficulty calming my mind. And I say, don't do anything with your mind. Do it with your body. Okay, that's the key. And this is what makes it really easy for people to enter into body-based practices. So one of the things that people can do right away is that they can take uh, a simple relaxing tea. You can
Mm.
just take a cup of chamomile tea. But instead of just drinking it, sit down, sip it, and pay very close attention to the body sensations that it produces. And it will start to produce very subtle sensations of comfort and relaxation. But if you are paying attention to it, you are bringing the prana of your mind into the body. And that is going to increase your body awareness of what the relaxing tea is doing. And normally you may not even feel any body sensations coming from it. But if you're paying close attention to it, you're going to start to notice that that chamomile is producing this incredible range of relaxing effects. Now, what has happened? We have potentized the effect of chamomile tea by paying attention to it and magnified its effects. So that's one of the things that we do is we magnify the effect of relaxing herbs. And then we really start to reprogram our brain so that we become aware of what relaxation feels like. I
Mhm.
have many patients that I work with, and I've asked them, do you know what relaxation actually feels like? And they say, no. Okay.
Oh God.
And so we have to train ourselves to enter into increasingly deep states of relaxation. So we can use herbs and we can use paying attention to the breath and we can use breathing techniques. And I also give people a specific method, listen to the heartbeat of their own pulse.
I like
And
that.
for a lot of people, listening to their own heartbeat is much, much easier than watching the breath. And if we incorporate all these things together, then we have this integrated method of using plants to help us relax physically, and we're paying attention to them. Mindfulness is potentizing their effects. And then we are listening to our own heart, and that's drawing our attention inward, and it has a very immediate, deep calming effect. So if we're doing all of these things, then within a fairly short period of time, we notice that, okay, I sat down and I was really tense and contracted and anxious and agitated. And now within 10 minutes, I'm in a completely different physiological and neurological state. What has happened? We have found the switch and we have turned it down. Now, great, but that's only the beginning because we have to do that over and over and over, many times a day for months and months and months. But then what we start to notice is that we can immediately get relaxed.
Mhm.
We can immediately proceed from where we left off and we can go deeper. Then we start to enter into the deeper spiritual dimensions of the inner insights into who we are. That is what meditation is all about.
That is so good. I feel so relaxed just listening to all of this. So, if nothing else, I hope that that other people have that same experience. So, if people are looking for you specifically, especially since you're doing telemedicine, where would they find you?
Yeah, thank you. I have a website. It is called crowconsultations.com, just my name, CROW, consultationsplural.com. That's where there is a page about my consultations, and people will see that I integrate natural medicine with a lot of contemporary issues. I work with a lot of people on complicated things like, working with medications and what I call clinical level self-care, how to talk to your doctor in an educated way, how to make complicated medical decisions, how to use natural medicine and allopathic medicine together, many of these types of topics. That's the consultation side. And then I also teach meditation, and we have free events regularly. And I also have courses that are posted, including that listening to the heart meditation system, which is a complete system, and also the integration between mindfulness meditation and taking herbs, which I call the illuminated herbalism because we're illuminating the herbs with our meditation. There's a course over there as well. So I have courses and I have consultations and I have events, and that's again crowconsultations.com. And thank you for mentioning that.
Absolutely. I'll put it in the description as well for anybody who's interested. So, thank you so much for your
Thank you so
time
much.
and your wisdom, your prana, and all that you brought to us today. Uh,
Thank you.
and hopefully we'll see you online.
Okay. And thank you for all the good work that you're doing.
Thank you.